Hi, I'm Dr. Zach Liederman. I'm a hematologist at University Health Network and the University of Toronto. This is a video on bleeding disorders and period health. It's important to note that there's not one definition, but there are some common features that guide us. So things we look for include periods that last for more than 7 days, periods that require someone to change a pad or tampon more than every 1 to 3 hours, passing large loony-sized blood clots, or having bleeding that interferes with normal life. There's lots of different reasons for why heavy periods can happen, and I encourage you to review previous videos in this series. Just to recap though, we look for problems with ovulation, abnormal tissue in the uterus, and where I specifically get involved, generalized bleeding disorders, which we term coagulopathies. Our body normally responds to bleeding by using complex proteins and cells. When the level of these cells or proteins is too low, or if they're not working properly, abnormal bleeding can occur. There's over 100 different types of bleeding disorders, but some common ones that I'll go over include low platelet counts, also known as thrombocytopenia, and platelets are sticky specialized cells that are made by our body that go out and bind to areas of bleeding and clot things up. Another common disorder is von Willebrand disease. Von Willebrand factor is a form of two-sided tape that floats around in our body and, like platelets, sticks to areas that are bleeding. Finally, other common considerations include issues with factor 8 and factor 11. In the general population, about 1 in every 1,000 people have a bleeding disorder. Now, this number is also higher in people that have heavy periods, but even still, most people with heavy periods will ultimately not be found to have a bleeding disorder. But for women that do have a bleeding disorder, almost 100% of them will experience heavy periods at some point in their life. Now, how we go about teasing out who has a bleeding disorder, we usually do this as part of a comprehensive team. So in parallel, in addition to seeing someone like myself, women will also see gynecologists as well as their family physicians. Within my clinic, we start with a comprehensive bleeding history. That's where we go head to toe, and we look at all the different ways people can bleed and also the frequency and severity of that bleeding. We can then plug this information into a type of chart called a bleeding assessment tool that can combine it all into a single number called the bleeding score. This is an overall representation of someone's tendency to bleed. A low bleeding score means that a bleeding disorder is less likely, where patients with higher bleeding scores require additional specialized laboratory testing to look for a bleeding disorder. Now, why this matters is that being able to figure out exactly why heavy periods are happening allows us to tailor and choose the best treatment possible. It also lets us not only treat heavy periods, but treat bleeding that can happen elsewhere in the body, and of real importance is being able to protect people during higher risk bleeding periods, such as surgery or pregnancy. Finally, some bleeding disorders are inherited. So being able to diagnose a bleeding disorder in one person may also allow us to diagnose and treat other people in that family. There's lots of different ways to treat bleeding disorders, and some of these are not any different than people with other types of heavy menstrual bleeding, and can include hormonal treatment as well as general medications that reduce bleeding, such as antifibrinolytics. For patients with more severe bleeding disorders, we consider specialized IV medications that replace the clotting factor or blood cell that isn't working.